Hello, I'm Dr. Brandt Gibson, and when it comes to peripheral neuropathy, a lot of times you can have one of four different types of peripheral neuropathy or any combination thereof. So let me talk to you a little bit about what these four types are. To give you a little bit of background, first you need to understand what the peripheral nerves are. Peripheral nerves are any of the nerves that don't include the central nervous system, don't include the brain and spinal cord. So all the rest of the nerves can be affected. These nerves can be either sensory nerves, motor nerves, or autonomic nerves. So let's start with the sensory nerves because those are the most common. There are two types of sensory nerves: the long nerves, the nerves that go from the spinal cord down to the extremities, and the small nerves, which are shorter nerves, which are a lot of times go to the tissues and so forth in those areas. So if there is an malfunction or an injury of the longer sensory nerves, these are the large fiber sensory nerves, that would be called a large fiber sensory neuropathy. And this can be a malfunction of any part of that nerve, the dendrite, nerve cell body, axon, myelin sheath. Any of those areas that malfunction will cause a large fiber sensory neuropathy. At the same time, you could have a small fiber sensory neuropathy as well, or instead of. And the small fiber sensory nerves, like I said, are those local nerves in the lower extremity or upper extremity that are more localized. They're not coming from the spinal cord, but they're actually in the area of the tissues and so forth. So you can have a large fiber sensory neuropathy, a small fiber sensory neuropathy, or you can actually also have a peripheral neuropathy to the motor nerves, the nerves that go to the muscles. So if you interfere with the function of the motor nerves, then you're going to actually have a motor neuropathy, which includes a malfunction of the muscles where they're not working like they're supposed to. You can actually get cramping. You can get fasciculations, which is the tensing of the muscle and relaxing of the muscle. And you can even get weakness. And this is a lot of times how motor neuropathy will present. So large fiber sensory neuropathy, small fiber sensory neuropathy, or motor neuropathy. And the fourth type is the autonomic neuropathy. This is the automatic functions of the body and can include any area that has nerve, the automatic nerves telling the body what to do. This could be everything from the expansion and contraction of blood vessels. This can include control of the blood pressure. This can include control of the bladder, the intestine, the stomach. This can include even some of the sexual functions. All those kind of things can be autonomic nerves, and the way they function or don't function can be affected by how well the nerves are working. So autonomic neuropathy can affect many of the other systems of the body, not just the nerves. Because if you get where the signal is not going to the body part like it's supposed to, it's not going to function the way it should either. So malfunction of any of those nerves will include an autonomic neuropathy. So even down to the sweating of the skin or the oil release to the skin. So large fiber sensory neuropathy, small fiber sensory neuropathy, motor neuropathy, and autonomic neuropathy. You can have any one of those, any two of those, three of those, or four of those. And that being said, all of this is included in peripheral neuropathy. So sometimes you find out you have a peripheral neuropathy and you find out some of these other symptoms that the doctors can't identify and can't tell you why they're happening are actually part of your autonomic neuropathy. And this gives you a huge amount of benefit to managing and controlling your peripheral neuropathy symptoms. So if any one of these is malfunctioning in your case or any combination thereof, I invite you to look for options so that you can manage your peripheral neuropathy and return back to your normal life. One of the ways that we offer to do that is you can actually reach out and watch the webinar that we offer each week, theneuropathywebinar.com, where you can actually find ways to manage your unique peripheral neuropathy. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 316. The four types of peripheral neuropathy. Thank you. Have a great rest of your day.